One of the mission of the health district is to ensure wellness and well-being within our community. We strive to ensure that everyone in our community has access to health care and to the resources that they need to make good choices about their well-being. The biggest issue in using our auditorium space was that the audiovisual equipment was unreliable. It was on the verge of not working at all.
Everything we were using was at least 15 years old. Our TriCaster, which we used to host the live stream, was being cooled by a desk fan. So I felt like it could kind of catch fire at any point, and every morning I was setting up, something new was breaking. If I got hit by a bus or I was sick on a Board of Health day, we were donezo. There was no live stream happening.
We also realized or discovered in our meetings that there was a bigger picture to what they needed, and that was for their auditorium, is what they call the room, to upgrade a lot of the AV gear that was also dated in that same room.
The space is a boardroom used for the Board of Health meetings for the County of Spokane, and it's a modular space with tables that can be moved. And so when you walk in the room, you have modular tables, you have a control room off to the left, and a podium at the front of the room. They have the ability to present to a new projector and two side-mounted 98-inch displays that display content from the far side or local presentation. There's a complement of wireless conferencing microphones on the tables that are used for local sound reinforcement. The broadcast system is a TriCaster switching system with 4 PTZ cameras that provide views of the room for the benefit of their public broadcast.
We found Avidex on the DES list. This is going to be used by people who have no background. They kept that in mind the entire time, and was kind of, I would say, probably one of the North Stars for what we were trying to do.
Once we realized that we could use the DES system and that Avidex was on the DES, we were able to communicate pretty clearly what our needs were, and Avidex came in and made an assessment, and it wasn't difficult to find solutions for what we needed.
They were so helpful in helping me navigate our own systems internally because I didn't know what the rules were. I didn't know what was required or expected. And they were also extremely flexible. I had one point person during the entire install. One person I could talk to, what they were doing during the install, and then training afterward.
Our board members are enjoying the new experience, and now they're able to really feel like they're experiencing the meeting. There was a commitment to helping us if there were any troubleshooting issues, and Avidex was here and showed up, and we're able to say, oh, we just had to work through a couple items that are common when you're starting to use brand new equipment and you're not quite sure how it's going to perform until you're in the moment.
The biggest contrast I've seen is how quickly and easily it is to just get live. Before, with that system, it would take me probably 2 hours. I would set 4 hours aside because something was almost certainly going to break, and now it takes me 15 minutes.